Hi, welcome to Elan Talk with Dr. Ikram. I am Ikram. In this program, we will be talking about all kinds of different health issues with different experts in the field. Today, we will be talking about COVID in developing countries, especially in Bangladesh. So sit back, relax, enjoy your time with us. Let's look at a few statistics. There are 8 million tested COVID cases in the world. The majority of positive cases are in the USA, as well as majority of deaths happen in the USA as well. Since the pandemic started, the disease spread around China, Europe, and USA quite swiftly. At one point, we thought it would not hit tropical countries like India and Bangladesh. We even thought that excess heat would kill the virus. But the virus game plan has changed. With strict measures and travel restrictions, the infection has come to a halt, or it has slowed down its spread around Europe. On the other hand, infection is rising in India, Bangladesh, and Brazil, the countries with big population and high density of people living in small space. Our concern is how to halt its spread and its devastation in these countries. What are the preventive measures available, and can we apply the Western theory in these countries? And more. Let's welcome our special guests. 3 of them are joining today. Dr. Shakil Farid, joining from Oxford. He's a consultant cardiac surgeon in Oxford University Hospital, UK. He is director of FRCS cardiothoracic surgery courses. Dr. Shakil, welcome to our program. And I'm going to welcome Dr. Zahid Ikram, joining from Sussex. He's a consultant in internal and geriatric medicine in Western Sussex Hospital, UK. And Dr. Thasbirul, joining from Indiana, USA. He's a clinical associate professor in Indiana University School of Medicine, and he is a medical director, Division of Pulmonary and Clinical Care Medicine, Indiana University, USA.
Thanks so much for inviting me.
Thank you very much. It's nice to have you all in my program. How are you doing today?
We are fine, thank you.
How is USA actually? Is the weather good? Is it like UK, or is it warm? It's cold?
Weather is Indiana. Weather is beautiful.
Wow.
We had beautiful weather as well in Oxford. It was pouring all day, so you know.
We always take it nice, isn't it? If it's pouring, it's nice. If it's sunny, it's nice. It's amazing. How is it in Oxford?
It was pouring all day, so.
How is it in Sussex?
Sussex.
Mute.
Mute, Ikram. Hi. It's mute. Yeah.
Oh, sorry. Yeah, Sussex is, sorry about that. Sussex is beautiful at the moment. Not too hot, not too cold, and it's dry. There's no rain, so good. Yeah, okay.
Excellent. Anyway, this is a live program, so call us on 0203 515 5788 if you have any questions or if you have any suggestion, or write us healthtalk@intv.co.uk, and you can also follow us on Facebook Live intv.co.uk. Thank you guys. Let's talk about what's happening. You guys have been writing a book or something, isn't it? Can you tell a little bit about that book? What's happening with it?
Yeah, so basically we have written a book. As you know, throughout the world, the health authorities are facing unprecedented difficulties in managing this COVID situation. In Bangladesh, authorities have already come up with a guideline, but we thought that, you know, we can come up with a guideline which is a small effort by the expatriate Bangladeshi doctors living in UK and USA, mostly with help of some experts from Bangladesh, to come up with a guideline which will help the local guideline committee. Because if you look online, there are too many stuff, too much information, too many papers. It's very difficult for the junior doctors especially to come up to any conclusion, to find out the important stuff.
So this guideline is for doctors in Bangladesh, is that right?
Yes.
Okay, please go ahead.
Yeah. So what we have done is there are around 40 to 50 authors who are specialists in their field, residing mostly in UK and USA, and there are some experts from Bangladesh. So what we have simply done is compiled the important stuff like the diagnosis, management of COVID, then management of patients with different medical problems such as connective tissue disorders, heart disease, kidney disease, etc. And one of the most important things, which is oxygen therapy. So we wrote about intensive care management, oxygen therapy, those kind of things. And we have also touched base the surgical specialties. And finally, there is great emphasis on infection prevention and PPE of the doctors. And it has been very well accepted in Bangladesh. A lot of junior doctors, middle grade doctors, even seniors are using it.
Excellent.
Well.
It's a great job. I think you should have had specialists in different fields and who would have treated their part of it. Is that right?
Yes, so we have medics, we have infectious disease specialists, we have intensivists, we have anesthetists, we have surgeons, we have, the only thing we didn't have is the epidemiologists, which we are gonna, probably include someone in future. So we had like all sorts of subspecialties and specialists included in the book, including gynecologists and obstetricians as well.
That's amazing job. How many pages roughly it's got?
It's around 240 to 50 pages.
Wow. Okay.
But many of the pages are just pictures, because we thought that rather than writing essays, if we put up important pictures like personal protective equipment pictures, what is level 1 PP, what is level 2 PP, and there are a lot of flow charts. It's actually a quite easy reading book. So it doesn't take long to go through lots of the whole book.
So is this book is in paper format or is it in a website format?
It's an online book because we thought that evidences are changing quite a lot.
Can our viewers will they be able to have a look at this website?
Yeah, they can download it for free.
Would you be able to say the website's name clearly so they can remember it?
shakilfarid.com/COVID-19. So the updated version of the book will always be available using that link. That's shakilfarid.com/COVID-19.
shakilfarid.com/COVID-19.
Yes.
Is that right? Okay, yeah. Okay. Let's ask something from Thasbir, who's joining from the USA. Thasbir, what's happening in USA with so many COVID cases? What you guys doing? What can you advise from your experience?
Thank you so much. We're doing terrible, to be honest, so I wish we can do a better job. So if you look at the US, I'll say New York and non-New York. So New York is not doing good initially. Now it's better now. But overall now, after the reopening phase by phase, cases have increased significantly. To date, we have 2.2 million people are affected. And 120,000 people died. Last 24 hours, we have 23,000 new cases and almost 750 deaths. So it's not decreasing by any means. It's going up and all steady. So unfortunately, our testing facility is not great. We're not testing enough to find the positive cases and make them isolation. So that is where it's struggling still.
Oh, okay.
So in summary, we're not doing a great job.
So the testing is not adequate, is that right? That's what you said?
You're right.
Okay.
Yes.
So isolation again is a problem there, isn't it? Have the country been closed?
If you find out the positive case, then you can advise them to isolate. Right? We know that many are asymptomatic, don't have the symptoms.
Yeah.
But if they walk around, mix with the community, what happens is it will spread the disease. And looking at the way it's spread, one person can spread to 3 to 4 people. So if I don't have the symptoms and I'm in the community mixing with other people, I may infect 4 people. That's 4 people infect 16 people. It goes up the number exponentially. So
in USA, is that minority community, is the BMA community who got infected more? Or is it? You don't have any serious statistics about
and I have the data. If you look at New York, Chicago, Detroit, all bigger cities, unfortunately, the minorities like African Americans or Hispanics, they are affected most. Fortunately, Asian people are not affected much because I think it depends on the population density, depends on healthcare access, depends on the income level. And
All right.
those are in poverty level, who doesn't have the healthcare access easily.
That's true, isn't it?
They're
In
who lives
USA,
in a crowded area,
yeah.
they're affected more.
The healthcare is not free in USA like UK, isn't it?
Is not the case, unfortunately, now. So there is almost 20 million people doesn't have insurance.
Wow. So that's a lot. Okay, let's talk about Zahid. Would you like to tell a little bit about the symptoms of COVID before we jump into the program? And let's remind the public what are the symptoms?
Sure. So most of the time, this is going to present with fever, with a cough, and with muscle aches, with sore throat. And on top of that, the other things could happen, like you could lose your sense of smell, you could get a headache, and you could get a runny nose. But the symptom to worry about is when you get short of breath. That tends to occur not in the first few days, but generally it's going to be in the second week. So once that happens, then you start to get worried. But before that, those are basic symptoms.
So basically it's flu-like symptoms, but we have to be careful with if we have respiratory problems. Is that right?
Exactly right.
Okay. What about testing and how can we test this?
I think it all depends on where you live. So on the whole, if you want to know what test is done, there's the RT-PCR, which is a throat and nose swab. Generally, it can also be sputum, saliva, other things, but generally a nose and throat swab. So RT-PCR is a quite difficult test to do. It takes a lot of time to do it, but it is the gold standard test. No other test has come to that standard. Even in spite of that, you still get 20% false negatives, and that's largely to do with how the sample is taken and the timing of the test. If it's done too early in the disease, it can be negative.
So if you test early in the disease, it can be negative. That's right.
That's correct. If you do it in the first 2 or 3 days, it could be negative. It won't necessarily be. It depends largely on how much virus is in the throat and whether the sample has been taken properly. Even if you get a little bit of virus on the swab, it will still grow on RT-PCR. It will still detect on RT-PCR because of the way that the test magnifies.
So general public, can they go and ask their GP for a test, or what the procedures now at the moment?
So it depends on where you live, I guess. So in the UK, you can get a test if you have symptoms, but you shouldn't be getting a test if you're asymptomatic, because I think no healthcare system can cope with that many tests. Maybe America can, I don't know what that from Thasbirul, but I think that would be a very difficult thing to do. Even for Bangladesh, I would say that it's the hospital-admitted patients and healthcare workers who should be tested, because they can only do 15,000 tests a day. So it depends on where you are. But in the UK, I would say that it should be done on symptomatic people.
Yeah, actually, I was tested last week. Now hospital, they test every employee now. So I have tested myself for this COVID antibodies or whatever, and vitamin D. But unfortunately, it came negative. So I didn't have COVID.
So yeah, so I can tell you about that. That's a different test. That's the antibody test. The antibody test is to see if you had the disease in the past. It doesn't really help us to make the diagnosis now. So it's for epidemiological purposes important. It doesn't even tell you whether you're immune or not. To me, it's a pretty useless test. So I wouldn't worry about that.
You wouldn't worry about the test. Okay. We go along with the symptoms. If we have the symptoms, we treat it as take the precautions, I suppose. Okay, Zahid, what's happening in Bangladesh? What are we hearing? Is so much happening in Bangladesh in these days?
Obviously, we are very far away, and whatever we hear and read is what we have to go with. But the situation to me sounds like it's pretty bad. And I think the numbers that we are hearing are not alarming, but the numbers are wildly inaccurate. That's what I believe, that many more people are getting infected and many more people are dying than what we are hearing. So many people that we know or care about are dying. Really quite scary. So that's why in our book, like Shakil said, we've always tried to show the way forward, what we should do next. So we've brought out 3 editions, and 4th edition will come out soon. It's always a way forward, what we should do. And I think at the moment, we need to get our health service in Bangladesh sorted out very quickly to cope with a huge wave of patients that's going to come very soon.
Okay, we have a caller online. Hello. Hello, welcome to Iron Health Talk.
Oh, thank you. It's me, Marlon, from the show a couple of weeks ago.
Marlon, it's nice to see you again, or talk to you again, of course.
Yeah.
Oh, go ahead, please.
Yeah, I've just been watching the show, and it's quite interesting to see. I was just wondering, I just wanted to ask actually, is there any new developments in any new drugs? Because I've seen one, I can't remember the name, it's quite a hard name. But is there any drug development
Dexamethasone.
to help with COVID-19?
Is it dexamethasone you're talking about?
Marlon, is it dexamethasone?
Yeah, so basically, shall I tell a little bit about this? So it's the recovery trial result. So around 7,000 people were enrolled into this trial. This was run by Oxford University Hospitals across 145 centers in UK. So they tested 5 drugs. So they tested, so they randomized the patient to lopinavir, then hydroxychloroquine, azithromycin, tocilizumab, and low-dose dexamethasone. Recently, plasma therapy has been included as well. What they have found is in patients who are critically ill or severely ill. So when I say critically ill, it means patients who are on ventilators. This low-dose dexamethasone has reduced the death by 1/3 compared to the patients who were not on low-dose dexamethasone. And in patients who were on oxygen therapy, it reduced the death by 1/5. So in summary, the low-dose dexamethasone, which is 6 milligrams for 10 days, can reduce death, significantly reduce death in patients who need oxygen or who are on ventilators.
So Zahid, before you go, I want to explain, Marlon, is this dexamethasone treatment, is it for people, patients who are on ventilation, or is it for anybody who's got symptoms of COVID?
It's for patients who are on ventilators. Yeah.
At the moment, it is still for patients who are on ventilation in ITU. Marlon, are you happy with our answers?
Yeah, thank you very much. So
Marlon, it's great. It's nice to have you on the show, and it's nice. I like your interest, and you keep watching my programs, and you've been in our program for 2 weeks back, isn't it? It's amazing for a young man like you to show that much of interest. Shakil bhai, I'm going to thank Marlon on behalf of you. Okay, Shakil bhai, what's happening in Bangladesh? Why are there a lot of health personnel dying in Bangladesh? What's
So the situation in Bangladesh is pretty bad. If you look at the official figures, nearly 98,000 people have tested positive. There are 1,300 deaths so far. And out of those deaths, there are 40 medical professionals who have been, who have died. 40 doctors.
40 doctors.
Yeah, 40 doctors. We haven't taken into account the other healthcare workers. I don't have the data. So if you think about infection, there are 3 factors that come into play. One is the patient factor, one is the hospital environment, another one is the host factor, the medical personnel. Now, there are problems at all 3 levels. The hospitals there don't have a robust infection control policy that we have abroad. Like, in a standard UK hospital, you would have 6 air cycle changes, or in an intensive care unit, you'd have up to 24 air cycle changes. Those things don't exist in Bangladesh. Then the second thing is the PPE. When you get a PPE in UK, you know that the standard is good of the PPE. However, in Bangladesh, no one knows what the standard of the PPE is, whether they're reliable or not. And then sometimes, the patients come, they do not actually tell their symptoms properly because they're afraid that they might be denied treatment if they're told that they have COVID, and they end up in a non-COVID hospital. And the professionals sometimes, I think, have, some of the professionals may have some misunderstanding about the appropriate use of PPE. Like, for example, if you have a big bear, the N95 mask or FFP3 mask is not going to have a good seal on your mouth. So these are the basic things that are important.
So as well as using the PPE, is a correct use of PPE is really important here to prevent the infection.
Yeah, absolutely. It is very important to use the PP appropriately. I'm not saying that they're not using it, but that's one of the factors. And if you look at the type of PP they're using, it's a coverall, which is a very hot material. It's a synthetic material made up of raincoat or something like that. In 35 to 40 degrees Celsius, it's really difficult to work with those coveralls. So what's happening is they're sweating, and the moisture actually reduces the protection when you're wearing coverall.
Are
So,
there,
I think it's a
are there any
combination of
measures
factors.
taken by government to help this issue?
I think so. Yeah, I think so. And those coveralls are not like the Chinese coveralls you get, which are very lightweight and they're not very hot. So I think all these factors are very important.
Okay, Thasbir, when does COVID-19 patients come to hospital? What is the time for them to think about going to hospital?
And thank you so much again. Actually, it's very difficult to comment on it. The reason is the COVID-19 is only 6 months old. We're still learning. We know in the past, initially we thought it only happens to the older population. Then we see it happens to the middle-aged population. Now we can see it happens to infant population. So it's really, we don't know who is going to affect. Number two is we don't know who is going to be affected critically and who is going to be, go through, without any symptoms. So it's very, very difficult to predict those. Looking at the data, now we quote the data is a Chinese data or European and US data that 80% doesn't need to go to the hospital, 20% need hospital, 5% need critical care support. But I don't know how that data is applicable to Bangladesh, because if you look at the Bangladesh, the population dynamics or disease pattern or nutrition status or healthcare accessibility is very different. Number two is the good side that Bangladesh has young population. Only 6 to 7% population are over the age of 65. That is a good side. But again, looking at the comorbid illness, like 25% of the population has high blood pressure. 12% population has COPD, 10% has diabetes mellitus. So these are all risk factors to get severe COVID-19. So what I tell to my patient that I don't know whether you need to go to the hospital or not. Whenever they have symptoms, any symptoms like fever, chills, shortness of breath, cough, myalgia, body ache, diarrhea, those or loss of smell or taste, those symptoms, immediately consult with your doctor to find out whether you need to go to the hospital or not. We know the term called silent hypoxia, that when many patients doesn't have any respiratory symptoms, they may have diarrhea, they may have fever, but no whatsoever respiratory symptoms, but they have significantly low oxygen level in the blood, and that can cause death, sudden death. So what I tell to the patient, even my experience telling me, the patient is stable today, tomorrow patient is dying. It happens. We saw not only older population, young people are dying as well. So my suggestions to them, whenever you have those symptoms in this COVID-19 pandemic, I said, take it as COVID, consult your doctor, talk to them, then decide about going to the hospital or not. Another thing is very important, when we decide, yes, patient can stay at home, and it's supportive therapy mostly, that is hydration, such as nutritious food, and then paracetamols for fever or body ache. But important thing to monitor is at home is shortness of breath, number 2, fever, number 3 is hypoxia. So there's a little device called pulse oximeter. I always tell my patient to buy those machines. It's a small device, very cheap, and monitor your oxygen level at home. If it goes below 92%, that's telling you should go to the hospital. And the another factors actually we need to consider. Who has comorbid illness, such as somebody has a cancer patient, some on immunosuppressive therapy, diabetes, high blood pressure, significant heart or lung problems. Those our older population are vulnerable. I think they should not ignore their symptoms and check. Don't think it's just simple flu. Check with your doctor immediately.
So people got other medical issues, they should be careful. and you told about the pulse oximeter. Is it easily available in Bangladesh as well, or is it just for the Western population?
No, it is available. To be honest, it's not that expensive. I think it's cost I think in 50 pounds or something like that.
Okay.
So in pounds. Easily available, but we are actually advocating, campaigning, me, Shakil, Farid, and Zahid, Ikram, we're campaigning to produce the pulse oximeter locally in Bangladesh rather than importing from China. So they're working on it now. We are really asking them to do shifting production, those who are pharmaceuticals or electronic companies, rather than making the refrigerator or medicine, produce pulse oximeter machine.
That's true. In Bangladesh, you got lots of factories there. I know that there are lots of factories being moved there, because in the beginning of COVID, and there was some people want to get PPEs, and I was talking to Bangladesh to arrange this. So it is available.
Yeah, Bangladesh actually exporting PPE. So
exactly.
There's the pharmaceuticals, which is Baximco Pharmaceuticals. They're actually exporting a PPE. I'm pretty sure they can do. What happened is, I think the direction, they're not getting the right direction, such as a lot of local electronic companies, they're making ventilators. I'm telling them, don't make ventilators, because we don't have the man behind the machine. We don't have trained doctors to run the ventilator, but produce pulse oximeter, produce high flow oxygen device rather than making ventilators.
That's a great point. Yeah, that's a great point. It's quite nice. I think we're going to go for a quick short break, and we'll see you after that. Today we're watching about COVID-19 in developing countries. Especially we are talking about Bangladesh. And these, my three invitees, they are experts in the field, and they've written a 200-page manual or book for guidance for the doctors. So far, we have talked a little bit about how it's going on in Bangladesh and a little bit of the symptoms, and we touched upon the treatment, and there's a lot more after the break. So be with us. I'll see you shortly.